Good evening, and welcome to Soluble, America's Political Central. Tonight, we're going to discuss healthcare as it relates to issues that are on the mind of American voters. We're going to be talking a little bit about healthcare as it relates to governing from the left side of the aisle, which is the Democrats, and governing from the right side of the aisle, which is Republicans. Now, before the Affordable Care Act in 2010, 2009, or whenever it began to be enacted into law, we really had nothing. There was sky high prescription drug prices. Doctors could turn you down. Hospitals could turn you away with pre-existing conditions. And so you were kind of like at the mercy of the medical industry. If they wanted to treat you, they could treat you. If your pre-existing conditions or your situation was too far gone, then it was kind of like a situation of good luck with that. And here we are. It's getting close, folks. It's getting close. To be exact, we're 19 days out. 19 days. 19 days, approximately 2 weeks and some change, something like that, before the midterms. And we'll decide, as a nation, whether we're going to take a sharp U-turn or continue down the road that we're going down. Now, let's be clear about it. Here at Soluble, our position is that the Republican Party is a party for the powerful, for the wealthy, for the rich. They are a party of money first, people second. The Democrats, on the other hand, are a party of people first, in particular, working class, what they call middle class America, the working class, and then money second. So there's the difference, folks. There's the difference. The Republican Party, wealth and money comes first, then people. The Democratic Party, people, their well-being, their families, their incomes, etc., then money. And that's the choice. The independents haven't, raised a powerful enough party, a powerful enough platform with a viable candidate. And so, that's where we're at as Americans. That's where our choices begin and end. Republican, Democrat. Until, the independents bring forth a strong enough candidate and really kind of begin to gain traction in debates, campaigns, or what have you. And so here we are, fast forward. Now, the Republicans, for their own reasons, they talk about government run healthcare is not good. It's going to drive up costs. It's going to give you somewhat a watered down version of healthcare. It's because in their argument, the government, anytime it gets involved in something and tries to, enact it or start it going, the Republicans' position is that, the government is just too big and it's too clumsy, and it's always going to make the situation worse. And so, there we were, folks, before the Affordable Care Act, also known as Obamacare. Before, the Affordable Care Act, we had, and we still do, we have an obesity problem in America. And the obesity problem, leads to a domino effect of all kind of other illnesses, high blood pressure, stroke, coronary diseases, et cetera, et cetera. And it was the Democratic belief that obesity in America was actually driving up healthcare costs, and it was a threat to national security. It was a burden on the deficit, and these are the things that compelled Democrats to push forward a mandate that everybody get covered when it comes to healthcare, that everybody gets covered. And it will begin to, after it was enacted, it was supposed to drive down costs, give consumers more of a choice. They couldn't be turned away with pre-existing conditions. And it was the Democrats' belief that this would stem the tide of the debt, the hurting that we took in the workforce from the obesity epidemic, which, as I said, led to all kind of other sicknesses, illnesses as a spinoff from obesity. And so, the Democrats were obligated to act, to put something on the books at the federal level to rescue, if you will, save, if you will, the American populace. Now, from the right, as I said, we had nothing. We had nothing. Before the Affordable Care Act, there was a lot of talk. But you can trust and believe. And, you can only go back and research and search out for yourself. With Republicans in charge of healthcare in this country, prescription drug prices skyrocketed. We had the opioid crisis that just went on a rampage in America, getting folks addicted, getting folks hooked. And it began to lead to the overdose crisis that we have today. It started out with oxycodone, cheap, ready available painkillers, pills for pain that, as I said, it drove us to the opioid epidemic, the overdose crisis that we still currently find ourselves in, even though we're trying to work our way out of it. We're still there. So where do we go from here? The Republicans talked about repeal and replace, because the Affordable Care Act was just such a terrible piece of legislation. Now, how can a universal health care program be terrible, be bad for Americans when, as I said, the obesity epidemic, the obesity crisis in this country was taking a toll on the workforce, the healthcare industry, period. And so the Democrats felt obligated, compelled to act and put mandates in place that would begin to drive costs down all the way across the board, from your doctor's visits to your prescription drugs to your, aftercare if you had to stay in the hospital, for extended period based on whatever the doctors had diagnosed you with. So this was a law that was enacted after careful consultation with a panel of medical experts who were brought to the table to discuss, where do we go as America? What do we do to bring healthcare costs down, make healthcare more accessible to all Americans, not just the rich and powerful, but all Americans. And this is what, the panel of experts come up with. Now, President Obama, he did trip himself up by saying that, if you wanted to keep your doctor, you could keep your doctor. That was a stretch. That was the president speaking before he knew all the facts. But as far as something to intentionally mislead or to deceive you in any kind of way, nothing of the sort. Nothing of the sort. The Affordable Care Act has been a win-win for all Americans who have signed up. Lower prescription drug costs. The doctors can't turn you away for pre-existing conditions. They can't discriminate or have, selective care as far as who are the patients they want to let in for screenings, exams, etc., and who are the patients that they want to turn away. So we have universal health care. And, say what you want, but our position here at Soluble is that, as we've stated before, when the federal government steps in over the states or steps in to take a look at what's going on to try to make it more accessible for all everyday Americans, then that's a good thing, because the federal government is the people. The federal government is the people because we are the government. A government of the people, for the people, by the people. And so that's what healthcare was sought out to be from a federal level. Now, the Republicans, when during the previous administration, they had a majority in both houses of Congress and the Oval Office. And their goal was to repeal and replace. Repeal and replace. And we had, by the grace of God, the two Johns that each time it came up and it looked like as if it was going to be taken out of law, written out of law, and actually repealed, John Roberts said it wasn't a mandate, that it was actually a tax. So that saved it the first time around when it went before the Supreme Court. And then, when the former president came in office and, he was doggedly determined to undermine or tear down everything that his predecessor had done, namely President Obama. He was determined to tear it all down, to take his legacy away. Not that healthcare was bad for Americans. It was just a personal vendetta, if you will. And the Republicans on the Hill, the Republicans in Congress, they did nothing to stop it. They did nothing to replace it with something better. And that's pretty much all it was talk about repealing and replacing. But, when they had majorities in all areas of federal government, they could do nothing. They can do nothing. If you remember the late, great Senator McCain, he went up before the election and put a thumbs down. He was a no vote on repealing. And as I've said before, many times, the late, great senator knew that even though the Affordable Care Act was not perfect, it was a good start. It may have needed a tweak here, a tweak there, but it was a great start. It was a great start for the American people. And even though it's not, discussed, it's not at the forefront of the Republican agenda right now, believe you me, they have never given up on taking it away, making the Affordable Care Act go away. And, you have to understand something if you don't already. As I said, this is the party that's for the rich and powerful. So when the medical lobby in the form of doctors, prestigious hospitals all across the country start to complain that now, they have to be more careful in the way they do their job. They have to make sure they're on their P's and Q's when it comes to medical malpractice. These are the things that the Republicans are fighting for. They're fighting on behalf of the doctors who, not purposely, but whether it's, a bad day, for whatever reason, malpractice happens. And it happens more often than we think. It happens more often than we think. And that's where Republicans fall on the side of, as I said, they're for the rich and the powerful. And so this is the main inspiration. This is the main motivation to do away with Obamacare, because the Republicans are listening to the prescription drug lobby, the doctors, the multimillionaire doctors in this country. That's who they're concerned with protecting. So, the bottom line, if it's up to Republicans, your health care in this country is really going to be compromised. It's going to be curbed. It's not going to be as many choices with the Republican health care plan as you see in the Affordable Care Act. No way. No how. Now, they've already attacked a woman's right to choose, which is definitely a part of health care. So, this is it, folks. This is it. In the 19 days that we have before it's time to make a decision, this is the position from the left, and this is the position from the right when it comes to health care in this country. You're just, as it relates to a Republican point of view, you're just a number. If you get sick, if you die, it's from the Republicans' point of view, it's like, their lives are patriot. They died for their country. Let's keep their family in our thoughts and prayers. And that's all you get. That's all you get, thoughts and prayers. No serious, get down to the nitty gritty, roll up your sleeves legislation that the Republicans are prepared to enact that will help you when it comes to health care in this country. And you've seen it. You've seen it. You've seen it before when the former president was in office. When it comes to repeal and replace, before they actually gave up on it for now. They were ready to repeal, but constantly, when the press would shove a mic in their face to ask about what do they plan to replace it with, there was no answer. There was nothing there but the smoke and mirrors, the spin that, I told you is a big part of the Republican playbook. There was nothing there that had any teeth, nothing of any substance that even remotely compared to the Affordable Care Act. And if it was, why didn't they bring it before the American people? Why didn't they bring it up on the floor for a vote? This replacement, this great replacement for the Affordable Care Act. Because there was no replacement, folks. There was no replacement. And so, this is what's at stake, if you will, in 19 days. This is what's at stake in 19 days. So, it's time for fact finding. It's time for speaking truth to power when it comes to healthcare in this country. For all Americans, not just some, but for all Americans. Have a heart for humanity, for human beings. But that's not how the Republicans see it. That's not how they see it. This free markets, they do nothing to lower prescription drug costs. It's a red herring, if you will. It does nothing for the American people to give them better access, lower prescription drug costs. It doesn't strengthen Medicare or Medicaid. Nothing but a bunch of talk. Now, this is opposition here at Soluble in trying to solve, in trying to debate both sides of the aisle when it comes to healthcare. It's really a no-brainer. It's really a no-brainer, folks, because the Republicans have had power. They've been in power during George W. Bush years and during the Trump years. They never came up with anything remotely close to the Affordable Care Act because they're listening to the drug lobby. They're listening to the doctors, the groups of doctors who form groups or boards of trustees or the medical professional board. That's the people that they're listening to. They're not looking at what average everyday Americans need in this country as far as better access, more access, and lower costs. That's not in their wheelhouse. That's not in their interest. And as I said, we're not going to go, too long with healthcare because, as I said, it's a no-brainer. It's a no-brainer. You have the Democrats who've tried to come up with a solution. And by no means do we here at Soluble feel as if, the Affordable Care Act, also known as Obamacare, we by no means feel as if, it's the perfect solution. It's a cure-all for all healthcare concerns in this country. It's not. But do the Republicans want to take it and work on it to try to make it better? So, there you have it. That's the question. Who's better on healthcare? Who's better for the American people? Republicans or Democrats? Now, as I said, and it's not much to it, folks. It's just not much there to compare. When you have two parties who've equally shared power in this country, who've equally held the reins of power when it comes to two-term Democrats, two-term Republicans, one term here, one term there. It's pretty much been equal power that's been shared in this country within the last, say, 20 years. So the Republicans have had just as much of an opportunity to bring forth healthcare legislation that is good for all Americans, that would lower the cost for everyday working Americans. And there's been nothing. There's been nothing from the right when it comes to healthcare but an attack. There's been nothing but an attack on those on the left who have tried to do something about it, who have tried to take the issue of the healthcare crisis, the obesity epidemic that leads to so many other diseases and sicknesses, and took a look at it for what it was as far as the Republican Party. Let's take a look at the obesity crisis. Let's take a look at it for what it is, and let's frame legislation. Let's write legislation and take it to the floor for a vote. You haven't had nothing. You haven't had anything. Nothing but talk. Nothing but empty rhetoric. Because what's happening on the right when it comes to healthcare is once, they go to the doctors throughout the country, whether it's a board of certified doctors, once they go to the drug lobbyists, then, there's nothing that they could bring back to the American people that they know that will be accepted, because this is all based on, this is a healthcare plan that's based on a wealthy point of view, or a point of view from the foxes who are guarding the hen house. I mean, if you want lower prescription drug costs, the drug lobby is not the place to go when you're looking for answers, because they're lobbying for more. And that's what lobbyists do. They're lobbying for more. They're lobbying for a more powerful position. They're lobbying for less regulation, not more. So, that's where it's at. The Republicans are consulting with doctors. They're consulting with the lobbyists. And then they know that once they hear from the rich and powerful, that they're not going to be able to sell it to the American people. They're not going to be able to sell it to average, everyday, ordinary working Americans. So what do? They push back on the Affordable Care Act, because they're doing their job. As I said, this party is for the rich and the powerful. It's for the rich and the powerful. And that does nothing when it comes to fairness, when it comes to lowering the cost, making it better for everyday average Americans. What it may take away from the deficit versus what it adds to the deficit. And these are all things we have to think about, in the 19 days that we have, that before we go in and make that decision. Think about it. The deficit is constantly going up. Is that good for us as Americans? No. Obesity in this country, if it doesn't level off, if we don't get it under control, is that good for us as a nation? No. Right now, there are reports from military recruiters that a lot of the young people who have a desire to go into the military are having to get kicked back because of obesity. They're having to work extra hard. The recruiting numbers are down simply because we're not a fit nation. And so, the ball's in your court. It's always in the people's hands. It's just, how we choose to vote from here. How we choose to vote. That's pretty much it in a nutshell. I mean, this doesn't call for a lot of soul searching, searching out the facts as it relates to a point of view from the right and a point of view from the left. As I said, from the left, you've been introduced to the Affordable Care Act. And if it's made a difference in your life, your family, your loved ones, your friends, then you owe that to the Democrats. You owe that to the Democrats. If drug costs have come down, hospital stays, emergency room visits, if it's gotten better, you owe all that to the Democrats. And the Republicans are pouting like spoiled children. They're pouting because their rich friends are having to level the playing field now and make it more fair for everyone. They can't price gouge when it comes to, doctor's visits. They can't price gouge when it comes to prescription drug costs. And the Republicans are pouting. Why? Why, when there's something that is the best thing for all of America, the Republicans have a problem with it? Because, as I've told you, they're for the rich and the powerful. Period. Period. And then the rest of us, we're just pawns in the game. Let's face it. We're just pawns in the game. So, that's it in a nutshell. I wish there was more, you know, but that's pretty much it. As it relates to a woman's right to choose, we already see what has happened. We already see what has happened through lies, cheating. We've had a former president seat 3 Supreme Court justices in a one-term president, not a 2-term president. So we see how low they'll go to take away a woman's right to choose, and they won't even make an exception for rape and incest. This is backwards thinking. This is prehistoric caveman type thinking. To take away all the protections that a woman has. And they need it because, let's face it, there are some sick men out here. There are some deranged men when it comes to how to treat a woman. And so, they need these protections. This is not something that is, like some sort of joke or something that, women all over this country are crying out for, and it's just noise. They're under no threat. They're under no risk. That's BS. And we here at Soluble have to call it what it is on its face. We have to call it for what it is on its face. So, if this is one of the most important issues to you, along with so many others, some Americans have more concerns about healthcare. Some Americans have more concern about crime. Some Americans have more concern about the economy. And so this is our third issue of discussion leading up to the midterms. We've did crime. We've did the economy. And now here we are with ideas on how to govern when it comes to healthcare in this country from a Republican point of view and a Democratic point of view. So it's your choice to make. We have 19 days. The Republicans have nothing to offer as far as a replacement for the Affordable Care Act. They have nothing there. And if they win the majority, they're going to try to chip away little by little by little until we're back where we started from. If they can have their way, they're going to take us back to where we started from. Because, let's face it, the Republicans are afraid of the melting pot. They are racist when it comes to the melting pot of immigrants that we are in this country. And this is the main motivation for trying to take it away, trying to take away the level playing field when it comes to access to affordable health care in this country. Plain and simple, folks. It's not a complicated issue at all. As a matter of fact, we feel like this is one of the more simpler ones as it relates to making up your mind about which party is going to govern the best when it comes to healthcare. This is one of the more simpler, no-brainers, as I said, because the Republicans have nothing. They have nothing. They have nothing. They have taken away the protections, the freedom of choice that women have had in this country. They have temporarily taken it away. And if we don't want more taken away when it comes to things that affect our health, not just physical, but even mental. And there's a lot going on in the world, in the country, where we need serious access to mental health facilities as well as for our physical well-being. And, you turn to the right. We already know what we got on the left. We have the Affordable Care Act. But when you turn to the right, it's silence. It's crickets. But when it's time for them to open their mouth, when it's time for them to say something, you best believe it's going to be on behalf of what's best for the drug lobby and the rich doctors in this country. The doctors have to be better. They can't under the Affordable Care Act, under the Democrats' plan. They can't just be a doctor who's going in willy-nilly, and he's operating or practicing medicine, and he's doing things that relate to medical malpractice. Under the Democrats' plan, they have to sit up and take notice now. They have to be careful now. They have to do their job in not saying that they haven't done it in a professional way, but they have to definitely be professional now. They have to definitely pay attention to what's going on under the Affordable Care Act. And to some of these doctors, and they're talking to their lawmakers on the right. It's bad for them. It's bad for them that they have to simply do their job better. Plain and simple. When it comes to medical malpractice, they have to do their jobs better. And that's something that has happened at the urging, the putting forth of legislation, if you will, from Democrats in this country, from Democratic lawmakers in this country. Now, that's really something to think about there in the 19 days that we have before the midterms. The doctors in this country are actually upset, uptight, because the Affordable Care Act makes them have to tighten up, makes them have to sit up and take notice and do a good job, to be more on their P's and Q's. So it's, if you're going to hear it from a Republican point of view, it's probably going to be, doctors are under attack. They're tying the hands of physicians. They've made this law where, it's unfair to physicians all across the country. That's not the case, folks. That's the scare tactic. That's the smoke and mirrors. That's going to the playbook to start dealing in fear mongering. That's all it is. That's all it is. Simply put, under the Affordable Care Act, doctors have to do their job better, more effectively. They have to come into the operating room. They have to come into patient care, dealing with patients on a daily basis, and be more alert, more aware. Be more careful about crossing their T's and dotting their I's, if you will. That's what the Affordable Care Act does. That's what it supports. And that will make it safer for patients. That will put patients more at ease. And that will probably cut back on some of what the Republicans call what we need as far as tort reform in this country. Just simply do your job. You can no longer malpractice or go in willy-nilly, operate, sew someone up, leave a medical instrument inside of them, and fight it to death in court, and your lawyers make it go away, and the person who's been affected through said malpractice or because of said malpractice walks away still broken, battered, feeling as if, who's going to watch out for me, the little guy? Well, the Affordable Care Act does just that. It does just that. So here we are, 19 days out. You have to ask yourself and be honest with yourself. Take a long look, have a long talk with the man in the mirror. When it comes to healthcare, there's nothing from the right. And if it is, they would have already brought it to the forefront for the American people. They would have already put it out there, knowing that it's important. Well, if it's not important to their rich friends, the lobbyists, then the Republican Party, the Republican candidates, the Republican lawmakers in this country have no interest in it, have no desire to make healthcare more affordable, more accessible for everyday, ordinary working Americans in this country. They have no desire there. So it's up to you, ladies and gentlemen. In 19 days, when it comes to this particular issue, healthcare in this country. Think about where we were before the Affordable Care Act. Sky high prices, denied doctor's visits, denied treatment. The doctors could deny you just on a whim because you couldn't afford to pay the high premiums, the high cost of emergency room visits. Everything about the Affordable Care Act speaks of fairness in pricing. Speaks to, being able to afford good health care in this country. And that's it. That's it in a nutshell. As I said, this, out of all the issues that we've discussed so far, crime, the economy, this one is one of the more simpler ones because there's nothing from the right to argue. There's nothing to debate, negotiate, to look at, to say, is this good for the American people? Raising the minimum age to purchase tobacco products. That's something that I think came from the right. That's a good thing. But, other than that, it's trying to eliminate mandates. When the country is going to hell in a handbasket when it comes to physical health in this country. And mental health, as I said, is fast approaching. It's coming in a close second, right, with our physical ailments because, we're living in perilous times. As I said, the previous president did nothing to calm the psyche of the American people. And so mental health, as it relates to health care, is just as important as the physical care. So that's it. You do your own research. Don't just bank on, trust in, believe in what we here at Soluble say. We go on a fact-finding mission. We do our research. We look, at healthcare priorities from way back, not just the previous Trump administration or the Trump presidency. We go back and we try our best to fact find, look at what the positions were, look at the stances when it comes to treatment in this country. So that's it. 19 days on the particular issue of healthcare. If this is one of the most important issues, if not the most important, when it comes to your vote, what's important to you? Take a look at it. Don't just believe in what we say. Take a look. The Republicans have nothing for you but slow death, high prices, and a bunch of smoke and mirrors. The opioid epidemic. When the Republicans could have stepped in, took control, brought the pharmaceutical industry before Congress to find out what was going on. How did we get into this crisis of addiction from pills, from opioids? If it was an attempt, it was a feeble attempt to bring this under control. And the pharmaceutical industry, it's got stupid rich. It's got crazy rich because there was no guidelines in place. There was no regulation. And that's the Republican playbook in a nutshell. Hands-off approach. Let the rich get richer at the expense of everyday ordinary Americans dying, getting hooked, busting up families, hurting our children, having grandparents to come back and have to be parents again because they're children or because the younger ones are strung out. This is what happens from a Republican point of view, from a Republican majority in this country. The opioid epidemic, the addiction crisis in this country. And as I've said, you have a Democratic Party that is for the people. And then, money is important. And you have the Republican Party. Money over people. Money is more important. Money, money, money. And don't get me wrong, we all need it to pay our bills, to live in this world. It takes money to buy goods, to buy services. But when you put such emphasis on money over people, and this is what you have: addiction crisis, sky-high drug prices, no equal access to health care, denied, time and time again. And these people are left to just go home and pretty much suffer until they die. And this was all before the Affordable Care Act. This was all before the Affordable Care Act. And the Affordable Care Act became law, and we began to see a light at the end of the tunnel. And what do Republicans do? They try everything in their power to dim that light or to cut it off altogether. Repeal and replace. You never saw the plan for replacement. There was a heartily attempt. There was a vigorous attempt to repeal it. Every effort to repeal it. But the same effort that Republicans should have put into replacing, they didn't. So therefore, there was talk about replacement. but you never saw it on paper. You never saw a plan on paper to show what the replacement for the Affordable Care Act would look like. You never saw it. So, what does it boil down to? It was just all talk. It was all talk, all show and no go. And that's where things currently stand now, here 19 days out before the midterms. This is Soluble, bringing you positions from the left and positions from the right that have been talked about, discussed, and attempts have been made to repeal. This is from the right. You have, when it comes to healthcare, attempt to repeal with nothing to take the place of it. Nothing that we've heard, seen on charts. Legislation that was put on the floor for a vote. We've seen nothing. Nothing when it comes to a replacement plan. So, as I said, we feel here at Soluble that it's a no-brainer when it comes to which party is going to do better when it comes to health care. Women have already lost their right to choose because of a tainted Supreme Court. The Republicans have no apologies. They're not sorry. They're not saying anything along the lines of, we were wrong. We have to make this right. They've doubled down. They've doubled down. There's no serious consequences for a rapist in this country right now as it relates to impregnating, and women have no avenue by law. They're losing more and more ground as we speak when it comes to being raped, being impregnated, and what can be done about it. What can be done to help the woman in this time of crisis? What can be done? So from the right, nothing. You're forced to carry the child to term and have the child of your rapist. When it comes to a Republican point of view, this has to do with health care. So 19 days out, a woman's right to choose is in serious peril, in serious jeopardy in this country. And, only the Lord knows what's in store for the Affordable Care Act if the Republicans can get and keep a majority. So it's up to you, the American people. If you value your health care, if you feel as though health care is the most important, if one of the most important, if not the most important issue in this country, then this is it, folks. This is Soluble, bringing you from our point of view at this podcast, where things stand on the right and on the left. On the left, you have the Affordable Care Act. On the right, you have nothing but more expenses. More expensive drugs, less choice. More expensive emergency room, doctor's visits, less choice. So you do the math. You figure it out. But trust and believe that's what it is, as we've laid it out when it comes to health care in this country. And what will happen more than likely with a Republican majority versus a Democrat majority on the issue of health care. Repeal and replace, only repeal. Only a dogged attempt to repeal. And had the Republicans succeeded in repealing, then what would we have had? Because there was nothing, there was no plan for replacement. There was nothing, no kind of legislation that was written for a replacement that would have worked for everyday average Americans. We're not just talking about the rich here and the powerful. We're talking about everybody. The haves and the have-nots having fair and equal access to health care in this country as it relates to positions from the left and positions from the right. So it's your choice to make in 19 days when it comes to health care. Those are the basic positions, feelings from the right, and those are the basic positions and feelings from the left as we've laid them out in this podcast. So we thank you for listening, but we encourage you also to do your own research. And if at any time you find that we were in error or we were misleading in some of our statements, we welcome the correction. We welcome our critics, our supporters to come on at any time and give us further points of view to enlighten us more on the issue of healthcare in this country. So that's it, folks, for this particular subject, this particular issue that's on the mind of the voters when it comes to healthcare. That's it in a nutshell. Repeal and replace with nothing ever to replace, or keep the Affordable Care Act in place, make it better where it could be made better. In the areas that it needs work on it. Work on it to strengthen it, not working on it to make it go away or to take it away from the American people. 19 days, you will have a decision to make. And it's a very important decision when it comes to health care, physical health care, and mental health care. A woman's right to choose. All these are on the ballot. And these are the positions. This is the position from the right, and this is the position from the left. We hope that we've been informative. We hope that we could have said something to maybe, lead you in the right direction or may spur you to do even further research. But this is pretty much it when it comes to healthcare in this country. There's nothing else to be said. Join us tomorrow. We will bring foreign policy to the forefront of discussion. Foreign policy as it relates to the midterms coming up. Foreign policy in this country. Ideals from the right and ideals from the left when it comes to foreign policy. This concludes our broadcast concerning healthcare. And as I said, we hope we can have been enlightening in more ways than one that helps you to make up your mind and make a decision in the 19 days that we have before the midterms. Thank you for joining us. We hope that you will continue to join our podcast on a regular basis as we try to bring forth a solution, a political solution, which is what we are all about here at Soluble. We've come into being because we feel as if we are one of the few guardrails, if you will, when it comes to democracy in America. And we're here to solve. We're here to make it better. We're here to open the eyes of the masses, to help you to see that you do have all the power in your hand when it comes to voting leaders in and voting leaders out at your will, at your discretion when election day comes around. So thank you for joining us. We hope we could have been, enlightening in more ways than one. We hope that you will join us tomorrow for our discussion on foreign policy as it relates to left and right majorities and what's at stake in this country. This is Soluble signing off. Good night and God bless.